What's going on, guys? This is Tyler, pharmacist with Pharmacy Update, and today I'm going to go over a drug that is used to treat hypothyroidism or low thyroid, and that is levothyroxine. I'm going to cover why having a healthy thyroid level is so important, what some symptoms are of having low thyroid levels, levothyroxine side effects, how it works, and at the end of the video I will give you my advice on how to take this drug. So let's get into it. So like I said, levothyroxine is used to treat low thyroid, and keeping a normal thyroid level in your body is extremely important. The thyroid hormones, known as T3 and T4, help regulate nearly every vital function in your body. And this includes heart rate, body temperature, breathing, your metabolism and body weight, and even things such as your cholesterol levels. So as you can imagine, if these levels are thrown out of whack, either too low or too high, this can cause many issues for you. So what are some problems you can have if your thyroid levels are too low, or hypothyroidism? Well, you can feel tired, sluggish all the time. You can have a decreased metabolism, which can cause you to have weight gain. You can be more sensitive to cold temperatures, muscle aches, tenderness, constipation, hair loss, among other things. I did not list them all here. And this picture here gives you some more possible issues that you could have. And as you can see, there are quite a few. So as you can imagine, if you have hypothyroidism, you will want to get this corrected because there are just so many symptoms associated with this. How exactly does levothyroxine help with low thyroid? Well, it is actually a synthetic form of one of the thyroid hormones that I talked about, T4 or thyroxine. Now, T3 is considered the active thyroid hormone because it has a much higher effect on the cells, but the good thing about T4 is that it can be converted into T3 by your liver or kidneys when it is needed. So T4 kind of acts as a storage for when you need more thyroid regulation. Now, it can take some time to work. It can take 3 to 5 days to feel any effects of levothyroxine, and it can take up to 4 to 6 weeks to get the full therapeutic effect. So if you're just starting out levothyroxine or you're changing your dose, give it some time to work. Don't quit just because you aren't feeling any effects after a couple days, because you may not be getting the full effect yet. Now, side effects of levothyroxine, they really just mirror the signs and symptoms of hyperthyroidism or too much thyroid hormone. So some things, you could get anxious, nervous, you could be hyperactive, sensitive to high temperatures or heat, you could have hand shaking or trembling, heart palpitations, and increased pulse. Basically just the opposite of hypothyroidism. So if you start to have some of these side effects, you may want to speak with your doctor because your dose might be too high in this case. Now, some monitoring parameters for levothyroxine. So you will want to regularly monitor your thyroid stimulating hormone or TSH levels in your blood. And this is usually how they can diagnose someone with hypo or hyperthyroidism as well. So what is TSH exactly? Well, it is made by your pituitary gland in response to your thyroid hormone levels, and it kind of acts like a temperature gauge would for an air conditioner. When your thyroid levels are low, your TSH levels will increase, and these increased TSH levels will normally stimulate the thyroid gland to produce more thyroid hormones. But if your thyroid levels are too high, your TSH will decrease. So basically, if your TSH is high, your thyroid may not be producing enough hormones, and if it is low, it might be producing too much. So it is important to get this level checked regularly to see if your current dose is working. So when you start levothyroxine or you're changing to a new dose, get it checked in 4 to 6 weeks. And once you find a dose that seems to be working well for you, get it checked again in 4 to 6 months. And then after that, just get it checked at least once yearly. Besides TSH, you will want to monitor for any signs or symptoms that the dose is too high or too low. So you'll want to monitor for the symptoms that we've already talked about. And in some cases, maybe your TSH level is normal, but you still have issues. The doctor can check your free T4 levels if needed. And now my final topic, how should you take levothyroxine? This is very important because the absorption of levothyroxine can vary widely depending on how you take it. If you take it with food, it can decrease the absorption by up to 25%, especially foods rich in fiber. However, my advice is just to be consistent with your dose and how you take it. Let's say that you have been taking this drug for years and you're just now finding out that it may be better to take it without food. If you found a dose that works for you and you've been taking it with breakfast every morning, just keep doing that. Because guess what? If you start taking it without food, all of a sudden you might be getting 25% more of the drug than you have been getting. So this may lead you to have more side effects. So just keep doing what works for you. Now, if you're just starting out, the recommendation to get the most out of your medication is to take it on an empty stomach at least 30 to 60 minutes before breakfast or any other medications. And this does include caffeinated drinks such as coffee. If this does not work for you, maybe you can't wake up early enough to do that, an alternative is to take it at bedtime, at least 3 to 4 hours after your last meal. So that is an option. Either way, make sure you take it with a full glass of water. And one last note here, if you take calcium, iron, or antacids, make sure that you're separating levothyroxine from them by at least 4 hours, because these can also heavily decrease absorption. So that's all I have. Thank you guys for watching. Please subscribe to my channel for future videos on pharmacy and medical updates. And I will also post videos like this covering medications. If you have any questions or comments, please leave them below, or you could always ask your doctor or pharmacist. So thank you guys again, and have a great day.